This safety video is going to go over all of the environmental emergencies you may encounter, as well as how best to handle them. By the end of this, you'll be equipped to handle bite wounds, stings, heat-related emergencies, cold-related emergencies, and even poisoning. Let's dive right in. In our first scenario, you'll encounter an individual who's just been bitten by an aggressive dog. First, you must ensure that the scene is safe, and then tell them you are certified in first aid and ask if you can help them. Then, retrieve a first aid kit and put on gloves. If possible, rinse the wound with soap and water. Then use dressings and pressure to stop the bleeding. You can also apply a bag of water and ice to alleviate pain and bruising. And finally, remember to always call a healthcare provider for bites that break the skin. Remember, each type of bite requires similar protocol, but with slight modifications. For example, with snake bites, you should ensure that the snake is no longer in the area before assisting the person. Remove any tight clothing and jewelry, as swelling is possible. Keep the injured person calm and watch for symptoms of nausea, vomiting, swelling, or weakness, as this may occur if the snake was poisonous. Be sure to call 911 if you don't know if the snake was poisonous or not. Scorpion and spider bites can cause muscle cramping, fever, headaches, vomiting, seizures, and in rare cases, unresponsiveness. In this situation, perform CPR if necessary. Lastly, jellyfish stings can be washed in vinegar or a combination of baking soda and water, and stingers removed with a towel or glove, and the injured area soaked in warm water. In our next scenario, you encounter someone who has just been stung by a bee. First, ensure that the scene is safe and obtain the person's permission to help them. If the person is allergic to bees or shows signs of being allergic, then call 911. Next, get a first aid kit and rinse the area. Locate the stinger and remove it with a credit card. Finally, apply a bag of ice and water over the bite area and stay with the person for at least 30 minutes to observe for signs of an allergic reaction. Next is a scene where you witnessed a runner faint who is likely suffering from heat stroke. Ask them if you can help them and ensure that the person lies down. Be sure to call 911. Then try to cool them by spraying water on them. Have them drink something with sugar and electrolytes. Remove as much of their clothing as possible to help them cool down. And stay with them until help arrives. Common symptoms of heat exhaustion include nausea, dizziness, vomiting, muscle cramps, fainting, or heavy sweating. Similar to heat exhaustion, but much more serious, symptoms of heat stroke include confusion, passing out, dizziness, seizures, vomiting, muscle cramps, and fatigue. In our next scene, you stumble across a person who is suffering from hypothermia. They are blue, shivering, confused, and cold to the touch. First, call 911 and get a first aid kit. If possible, get the person out of the cold. Dry them off and remove any jewelry or wet clothes. Cover the person with towels or blankets and stay with them until help arrives. In our final scenario, you are standing outside when suddenly someone runs out of a building, having trouble breathing and having abdominal pains. After ensuring that the scene is safe, make sure the person is safely away from the contaminated area and in fresh air. Never enter contaminated rooms to help other people, as you risk being poisoned as well. Call 911 or the National Poison Control Center and try to give them as much information about the potential poison and symptoms. Stay with the victim and monitor their symptoms until professional help arrives. If the person is unconscious and vomits, turn their head to the side to prevent choking. Begin CPR if the person shows no sign of life. Have somebody gather pill bottles, packages, or containers with labels and any other information about the poison to send along with the ambulance team. Poisons can be swallowed, inhaled, absorbed, or injected. How you treat the person is dependent upon their symptoms and whether you know the type and amount of the substance that caused the poisoning. For swallowed poison, remove anything remaining in the person's mouth. If the suspected poison is a household cleaner or other chemical, read the container's label and follow instructions for accidental poisoning. For poisoning on the skin, remove any contaminated clothing using gloves. Rinse the skin for 15 to 20 minutes in a shower or with a hose. For poison in the eye, gently flush the eye with cool or lukewarm water for at least 15 minutes or until help arrives. Be sure that the contaminated eye is below the clean eye so that running water does not push chemicals from the contaminated eye back into the clean eye. Someone who has come into contact with poison may exhibit vomiting, pain, trouble breathing, drowsiness, seizures, confusion, so be vigilant. I hope you enjoyed today's video. But remember, the world can be a very dangerous place, so stay safe out there. Goodbye.